Today we finished in 1 hour because we have a special edition. We have a special guest coming to the yoga session today, and he will talk about pandemic health and about health in this COVID-19. So let me come closer to the camera. And it is open floor, so if you have any questions, comments, you can do that. But let me first introduce our special guest today. So welcome everyone. Welcome to our special 30-minute question-answer discussion session with Dr. Dilip Sarkar. He is a retired vascular surgeon turned yoga therapist and Ayurveda practitioner. And he's the former chairman of a surgery department and the chief of staff for a prominent hospital in Virginia. He teaches yoga therapy with a focus on combining yogic wisdom and the science of Western medicine. He has served as chairman of the board for the American Heart Association, and he's the past president of International Association of Yoga Therapists in USA. And he currently serves as the chairman of the School of Integrative Medicine at Taksha Institute. His book, titled Yoga Therapy, Ayurveda, and Western Medicine, is widely used by yoga therapists across the world. So welcome, Dr. Dilip Sarkar.
Okay, I'm here.
For some reason, I don't see you, but I'm sure you're there. Oh, there you are. Okay, I see you now.
You don't see me. How about me looking at a speaker view so I can see myself? Okay.
Wonderful.
Okay. Now we are talking. Let me see first.
So we will start with a question, and maybe I don't know if others have questions, but I have one question I can start with, and then if others have questions, they can chime in. So, Dr. Sarkar, as social and physical distancing continues, fear and anxiety are on the rise in these turbulent times. COVID-19 is infectious, but so are emotions of fear, anxiety, and panic. Sometimes these emotions can be more contagious than the virus itself. And parents, especially, and not only fathers, mothers, so I'll say, it's a Father's Day, but I'll say parents who are anxious will also rub some of that anxiety to their kids. And on the flip side, parents who are calm will also rub their calmness to an anxious child. So can yoga therapy help with keeping us calm? And if so, how?
Okay, so you want me to answer all of them? Huh? I'll be glad to. No problem. It's a beautiful question. Okay, before I answer all this stuff, at least let me tell you, thank you for inviting me in such a auspicious day. So you have mentioned few days, but I have to mention few more. Huh? So today, obviously, is a International Day of Yoga. It's June 21st, longest day, summer solstice in Northern Hemisphere. And the most important character of this day is that sun is just above our head. And if you've been outside, you might have noticed you don't cast any shadow on this day. And even if you cast a shadow, your shadow remains as stillness. Shadow doesn't move. So this is a stillness called sthiti. And the yoga postures, yoga asanas are described as sthiram sukham asanam, stillness. It's a wonderful day to practice yoga. It happens to be Father's Day, because Father's Day is in the third Sunday of June. Happens to be on the World Music Day. Today is a music day. Today in the music, you honor all the amateur singers. Today is a solar eclipse. combination of this, if you're doing yoga, it's a wonderful experience. I'll tell you a little bit about the story about International Day of Yoga. But before that, let me answer what Abha is asking. This question I've been asked so many times. First of all, the situation we are in with the COVID-19. We call it a respiratory virus. It's like a flu virus. It transmits through your droplet spread and primary effects in the lung. And the lung causes a profound inflammatory response. I'll come back a little later in our discussion. But we had no idea that where the virus came from. We know for sure we call it a hybrid virus. It came from the combination of two viruses. And most of the studies showed that it came from bat and a pangolin. Since we don't know anything about it, we had a tremendous fear. And most of us know from yogic standpoint, a fear or fear of unknown is a stress. Stress is described as a fear of unknown. Panic. Look at the panic we are in. We're all being quarantined, all at home. We have no idea. And most important thing, what I tell people, that I am doing everything by the book, what CDC has recommended, what WHO has recommended, but I still can have this virus. This is extremely contagious virus that created my anxiety, panic, fear, anxiety, nervousness. I'm nervous. What is going to happen to me? It's going to kill me. Sadness, even depression. And Abha was asking, yes, we cannot change anybody. We can change ourselves. Whatever we have, our mental state, we can, especially in a family, we can transmit to our children. So where does our yoga therapy stands for panic, fear, and anxiety? There are two sides of the coin. First, let me tell you a little bit of a spiritual and psychophysical aspect of yoga. As you all know, yoga is a union. It's a union of your body, mind, and spirit. A practice of yoga makes us to do the introspection. The outcome is called a self-realization. You start looking inside yourself. And most important thing what happened in yoga practice, that you accept the things as is and you live in present. A transformation of yoga practice is profound. Like you can think, all of us we know. We are bending down, trying to touch our toes. One day we cannot, but slowly and slowly with practice, eventually can touch the toes. What does it mean? This is called a neuroplasticity. When neuroplasticity sets in, then what I do, I go ahead and start looking inside myself. Accept things as is. So what did all these things, panic, fear, anxiety, nervousness, depression, all this cause to us? First is a state of your minds. First, the state was a denial. It's a virus. We'll go with denial. So from the denial, when it doesn't work, we become steps. Maybe we become angry. Why? Why it is in the US? Why 100,000 people are getting this angry? Then you will fear now. You know what? I can have that virus. Then have a depression. You go through all these phases. But you know, all the outcome of these phases in my mind causes acceptance. At this moment, you know, what we are going through, we are in a phase of acceptance. You know, we have to accept it. The virus is here. We're going to live with it. There is no vaccine. There is no treatment. What are we going to live with it? We're going to live with the college, your immunity, herd immunity. So in a state of yoga practice, what happens, you go from the denial to acceptance. So you don't go through all these different phases of your mind. The yoga therapy is a profound therapy for your COVID-19. Second part is that all these symptoms, what you're going through, panic, fear, anxiety, nervousness, sadness, depression, and its total outcome is your insomnia, sleeplessness. And we all know today the sleeplessness causes lack of immunity. Our immunity goes down. Guess what? My immunity is down. I'm going to get more exposed to your COVID-19. There is no vaccine, there is no therapy. But all the research studies today have shown that a asana practice in yoga therapy, which is called a progressive muscle relaxation. What is a progressive muscle relaxation means that you don't get in and out of a pose. When you go into an asana pose, that you stay in the pose. You stay in the pose. Remember, we all taught, we all are teaching, and Abha is teaching all the time. You stay in the pose without any pain, short of pain. You stay in the pose with effortless breathing, exhalation longer than inhalation. And you go through this, a progressive muscle relaxation. We talk about 3 stages of asana, the physical posture. Arambha, beginning. Muscle contracts to put you in a pose. And you stay there a little longer, muscle cannot stay contracted that long. It will start to relax. Before relax, it causes a little bit of a twitching. That is called sthiti, stillness. And finally, it's called a visarjan. Visarjan is called a surrender, profound relaxation. All the research studies today have shown that progressive muscle relaxation improves your quality of sleep. Sleep is not how long you sleep, but how it's a quality. Call it REM, non-REM sleep. It's non-REM sleep, stage 1, stage 2, stage 3, stage 4. So when you get your sleep better, your immunity gets better. And let me tell you a little bit of a medical part of it. And I'm a physician, I am an integrative physician. So what is this COVID-19 doing for our lung? Obviously, it is a droplet spread. It is going through our nose, going through our mouth, going through our respiratory system. And in the lung, first, it is attached to the lining of the lung. It is called here the lung cells of the lung. And that's where the corona comes from. The corona attaches to the lung. So let me tell you just few, the medical part of it. When it attaches to the lung, it uses an enzyme called the ACE2, ACE, called angiotensin converting enzyme. It needs ACE2 to attach to the lung. And guess what? ACE is a substance which increases our blood pressure, increases our cardiac issues. It causes constriction of the blood vessel. So all the people in this country, or all over the world, taking a medication called ACE2 inhibitor. If you have a cardiac problem, you get about 4 medications straight from any cardiologist: aspirin, statin, beta blocker, ACE inhibitor, or called ARB, angiotensin receptor blockers. There is enough studies have been shown today, but studies are not enough, that this is a very important medication, life-saving medication. Don't stop. Next, what happens that a coronavirus in the lung creates a profound inflammatory response. And we have the inflammatory markers. Inflammatory markers, and I'm just going to use some medical terms, called cytokines. Cytokines, you will say in the market, is called that IL, interleukin, interleukin 6, interleukin 1, interleukin 1B, another called your tumor necrosis factor, TNF. I'm telling you these terms are very important, is that there is a medication in the market already for people with a inflammation, like say people with your rheumatoid arthritis, Crohn's disease, psoriasis. They get a medication, you may not have the name, called Humira, but these are all either tumor necrosis factor blocker or IL blocker, interleukin blocker. Because all the research has shown that a progressive muscle relaxation and your voluntary regulation of breathing. Remember, with all the pranayamas, you did all the practice, asana practice, but voluntary pranayama is a voluntary regulation of your breathing. Think about breathing. Breathing is both conscious and subconscious. I'm sleeping, I'm breathing. That is a function of the lower part of the brain, called the brain stem. But I can take consciously deep breath in, or I can deep breath out. This is the function of my upper cortex of the brain, conscious brain, called motor brain. In fact, the effect of this is beyond that. It's called emotional brain. It's called a limbic system. There's a pathway called psychoneuroendocrinology, limbic system, hypothalamus, pituitary axis. So all the studies have shown today that the effect of progressive muscle relaxation, voluntary regulation of breathing, converting into a subconscious to conscious, decreases your tumor necrosis factor, decreases your interleukin 6, interleukin 1, and also there is an inflammatory marker called C-reactive protein. And when you breathe through your nostril, I think Abha has already mentioned a few times, air going through the nose is like a personal air conditioner. It filters the air. It warms up if the water outside is cold. It will cool down if outside air is warm. Then when it passes through the mucosa, it secretes a substance called nitric oxide. Nitric oxide is a powerful vasodilator. It opens up the blood vessels. So it helps when the inflammation sets it in the lung. It helps with the proper, we call it a diffusion. Oxygen can go better into the lung. It acts into the blood vessel lining called endothelium. The endothelium secretes a substance called cyclic GMP and acetylcholine, which increases parasympathetic tone. So coming back, saying that between the both a psychological factor of COVID-19 and physiological changes in the lung, the practice of yoga therapy, which we describe as a progressive muscle relaxation, called relaxation response, activation of parasympathetic tone, and voluntary regulation of breathing, controlling the inflammatory markers. Today, hopefully, is a preventive and therapeutic for COVID-19. Sorry, I took too much of your time, but I had to tell you the state of yoga therapy and COVID-19. Thank you, Abha, for asking. Maybe open up to all the participants on the audience if they have any further questions about on this side.
Yes, there is one question in the chat room. I'm looking at the chat here. And so between yoga and meditation, what would you recommend for calming the mind?
This is a very important question. There is nothing called yoga and meditation. Yoga is meditation. I have a whole series I'm doing called Through Your Indian Embassy. I have 4 sections. The first one is called Yoga is Meditation. Second one is your pranayama is meditation. Third one is called your daily lifestyle. Dinacharya is meditation. So what happens? You don't meditate. Meditation will come to you. You prepare your body and mind and your breath, and slowly you enter. Meditation is the 7th limb of yoga. There's the 8 limbs of yoga practice: yam, niyam, asan, pranayam, pratyahar, dharan, dhyan, samadhi. Dhyan is your 6th, 7th limb. So I'm sitting here, closing my eyes, paying attention to my breath. It is not a meditation. Why? Because my physical body is not ready. How do my physical body get ready? My physical body gets ready with a asana called Thiram Sukham Asanam. Body has to be still. You have to be happy. I'm sitting in this posture. I've been sitting in a long enough, called neuroplasticity sets in. I can sit like this. So the answer to your question is meditation is medication. No question about it. All the effect takes place in our body and mind is through meditation. And meditation is ultimate outcome of a yoga practice. So for all of you, the term we use, especially in the West, I'm doing yoga and meditation. I can say I do yoga asana and meditation because asana is the 3rd limb, meditation is 7th limb. So answer to your question is, yes, yoga is meditation, and you practice a progressive muscle relaxation, voluntary control of your breathing. Slowly you will enter into the 5th step. It's called pratyahara. The name pratyahara means reject. Ahar means input. Input of your 5 senses. You control your 5 senses. They enter into a dharan called a focus. And in the focus, you stay with your eyes closed, focus for a longer time. Slowly and slowly get it defocused. And what is meditation? Meditation is a state of mind when you have the thought process. We have thousands and thousands of thought processes. The repeat thought process. Majority is in the past, in the future. In a meditative state, you enter in between the thought process. It's called a gap. Slowly and slowly you increase the gap. So you have the same thought process, but doesn't chatter, it doesn't come back. In yogic term, we call it chitta vritti nirodha. So what is meditation? Outcome is stay calm in the middle of crisis. So the question you have, the answer is yes. Look at the crisis we are in the COVID-19. If you do a daily practice of yoga, do a daily yogic lifestyle called dinacharya, you will stay calm in the middle of this crisis. You will increase your immunity. Remember one thing, a famous last word from a yogi. Immunity comes from within. It doesn't come from outside. All the advertisement you're seeing, oh, take vitamin C, take your triple I, take zinc, take Chyawanprash, take this, do that. All immunity will come from inside. So answer to it, yes. Answer is meditation, but yoga is meditation. Thank you for the question. What else? I'm not looking at the chat room, so you were looking at.
Yes.
Tell me what are the questions you have. What are the questions you have?
I don't see any other question in the chat room, but if anyone else wants to just speak up, they can talk.
Okay.
We still have 3 minutes.
What? How many minutes?
3 minutes.
I thought you have a whole night. You know what you're going to do today?
I think Jack may have a question. He's waving his hand, so.
Okay.
Happy Father's Day, Jack.
Thank you, Abha. Doctor, can you compare yoga with qigong?
You know, all the practices, I will see at the end, it's quieting down your mind. Okay. So if you look at the practice or asking qigong practice, you know, or if you go to China, there's a lot of, you know, the Tai Chi practice and all of them. You'll see that all the physical, say, we'll do call a moving meditation. We'll be doing, say, we call it a west rotation pose, Kati Chakrasana. Huh? Go back, we'll do the breathe in, breathe out first, breathe in and slowly move our body and to the physical posture. But at the end, what happens, this is all quieting down the mind. And the ultimate effect is having a better quality of health. And as I said, the better quality of health always is called activation of your parasympathetic tone. And Abha also tells all the time, strong digestion, easy elimination, good night's sleep. So there is no comparison between yoga practice and the qigong practice, and no comparison between yoga practice and your Tai Chi or any other traditional system of healing practices. I was in a panel discussion. It was in China. We have, you know, I was a yoga therapist, and there is a qigong, and there was a, you know, all traditional system of healing. But at the end of our discussion and dialogue, we came up with the same outcome. And the outcome we use in yoga therapy is called Chitta Vritti Nirodha. Chitta is your mind, Vritti is a chattering, Nirodha is control. Controlling the chattering of the mind instead of 30, 40,000 thought process, you can have a better and better proper gapping and stay calm in the middle of crisis. The answer to your question is both the practices are good, both the practices have excellent outcome, but all ends up quieting down your mind.
I have a question. Dr. Sarkar, thank you very much. When are you coming back? Oh.
I can hear it. Speak up.
When are you coming back to Tampa?
When am I coming back where?
To Tampa, Florida.
Tampa, Florida. You know, the first question Abha was asking. What was the question you had, Abha? Panic, fear, anxiety, family stress. And I'm looking at all the medical journals. You know, we have a very famous called New England Medical Journal. All the data is being published and everything. But it looks like this is such a permanent effect in our socioeconomic system. We don't even expect anything even this year, 2020. All of our conferences in 2020 has been all canceled or put on online. So 2020 is gone. 2021, you see, 2022 may be? Does it give you an answer to your question? Not in 2020, maybe in 2021. What else?
I think we have reached our time limit. So with that, unless anyone else has any pressing questions, we can stop here. So thank you. And I think in the end, the only constant is change. So this is not permanent. This too shall pass. So thank you, Dr. Sarkar, for coming.
Yep.
And thank you, Ravi, Deepak, for hosting this. And thank you, everyone else.
My final statement. I have just looked at a paper with all the pandemics we have, starting from BCE. You know, BCE. I have a list of all the pandemics, and every pandemic showed it came and gone. So this pandemic will go away one day. We don't know when. Abha, somebody asking about Abha. Okay, if not, thank you. Abha, thank you, and
Thank
continue.
you.
Achha, Abha always tells, you know, we have been telling to everybody, the Sanskrit word, but almost becoming English now, called Karo Yog, Raho Nirog. Huh? Do yoga and stay healthy and disease-free, but for daily practice. Thank you.
Thank you.
Yeah, namaste.
Namaste.
Namaste.